Rosie. I'm a NDSCS nursing student, and I'm here to teach you today about chronic pain. Chronic pain just means that the pain has lasted for longer than 3 months. So we'll get right into it. So first we're going to talk about the prevalence of chronic pain. Chronic pain is experienced by 20.4% of adults in the United States, and 7.4% of these adults have stated that their daily activities and their work life have been affected negatively by their chronic pain. So chronic pain is most prevalent among adults that are aged 45 to 64 years old, but does have a range from anyone, as anyone can be in chronic pain. And many of these individuals do not know how to effectively decrease or treat their pain, so they have just been living with the pain. And a study performed in 2019 found that women are more commonly in chronic pain states than men. So now we're going to talk about medication use issues not in a sense of different types of medications for treating the effect, like the disease that has caused the pain, more so straight pain medication specifically. So people with chronic pain can commonly feel hopeless about their treatment, and they may become addicted to opioid medications that were prescribed to treat their chronic pain, as opioids are not meant to be taken for very long periods of time because of addiction and because they don't work as well after they've been taken for a longer period of time. And many people also experience complications due to prolonged use. Some of these complications include constipation, depression, decreased immunity, so your immune system can't fight off infection as well, and your liver and or kidney disease can become more present, or your liver or kidneys can even fail just because of how the pain medication is excreted and filtered through your blood. So a study showed that many clinicians lack the knowledge of how to properly use opioid medication, which implies that they also do not know how to teach you to properly use pain medications. So next we're going to talk about the alternatives to medication, which is the point of this whole video. So the non-pharmacologic pain management options include chiropractic care, so just going to the chiropractor, massage therapy, even just once a month getting a massage is beneficial, breathing exercises, which we'll talk about more in the next slide, acupuncture, physical therapy, which can be prescribed by your physician, and hot or cold compresses can also be really beneficial, just the 20 minutes on, 20 minutes off. Community support groups to talk to other people about your pain just because of the psychological effects caused by it. Exercise is also really helpful, just as much as you can. It doesn't mean an hour of straight running for every day just to treat your pain. There are many ways that exercise can help you, and you should talk to your physician to find specifically what would be best for you. Guided imagery is another option that is not as commonly known about. So if you look at the image of the beach to the left, that picture is something that you could imagine it's a place you could imagine you're at. So you could use all of your 5 senses to think, okay, you could look at the picture and pretend you're there. Imagine feeling the warm sand under your fingers and your toes. Imagine the heat feeling on your skin from the sun, the smell of the salt water, and different things like that can also help with pain a lot. So now we're going to talk about breathing and how to deep breathe effectively to help your pain. So you could read all the benefits of deep breathing if you want to pause here and just read through all those. They're pretty interesting and I recommend you read them. So I'm just going to teach you how to deep breathe effectively. So first you count to 5 while inhaling, and you're counting slowly during this whole process. You don't want to be counting too fast or you won't feel all the benefits that can come with deep breathing. So we're going to inhale while counting to 5 through the nose. While you're inhaling, you want to expand your belly so that you can breathe deeper and expand that diaphragm so your lungs can really absorb all of that oxygen, and then you're gonna hold that breath in for 3 seconds, and then you're gonna count to 5 while exhaling slowly. And you almost want to make your lips pursed while you're exhaling, just to make sure you're breathing out all of that carbon dioxide to help your lungs work more effectively during this whole process. The more oxygen in your body, the better. There's no such thing as too much in a sense of just normal breathing. And you should repeat this process until you feel more relaxed and your pain starts to go away. It's unlikely that it will completely decrease from this method, but it would help to do it anyways. So the picture on the right here is 7 ways to naturally relieve back pain, just because that's one of the more common types of pain that people experience chronically. But all of these different tips can help for any type of pain, like knee pain, shoulder pain, anything else can be helpful for treating these. So it can help to use a heating pad right away in the morning if that's when you're in the most pain. Regular massages, like I said, as often as once a month is helpful. Having a good laugh or yoga are also very beneficial practices. Changing your sleep position can also help a lot with different types of pain, not just back pain. Long hot baths are almost therapeutic in more of a mental sense, just as much as they are in a physical sense. So it's also helpful to take the plunge, is what it says, but that just means go for a swim. Water aerobic exercise is very beneficial for all parts of your body, your joints, your muscles, everything can benefit from swimming. And it's also important to pay it forward and teach other people the ways that you've found that can treat your pain, because maybe you can help them and treat their pain as well. So these are just some of the best ways to treat pain, even if it's not chronic. If you haven't had pain for more than 3 months, these are still great ways to treat your pain. And that is all I have for you today. I hope you can treat your pain. Thank you for watching.